On March 16th, San Francisco Mayor London Breed had a press conference. Her message that day shaped her city's future for months to come.
The new public health order that we're announcing will require San Franciscans to remain at home with exceptions only for essential outings.
The Bay Area was the first region in the state to issue a stay-at-home order, with the rest of the state following 3 days later, says John Swartzberg, an infectious disease expert at UC Berkeley.
Although that number of days doesn't sound like a lot, given how fast the pandemic was spreading, it certainly helped a great deal.
San Francisco's initial response also set the tone for its stance on reopening. Elected officials, health officials, and residents all seem to understand the region would remain restrictive, says Erin Alday, the San Francisco Chronicle's health reporter.
Right from the start has been just really aggressive and really fast. So just, anytime there's sort of the hint of things moving in the wrong direction, they kind of respond to that and clamp down on it.
After 2 months with a statewide stay-at-home order, Governor Gavin Newsom started allowing counties to reopen businesses. Public health officials now largely view that as a mistake. The state began to see a surge in COVID-19 cases. Counties responded differently.
San Francisco did experience a summer surge, like every place in California. It never really blew up quite like it did in other places. And as soon as they sort of saw that happening, the city immediately halted its reopening, whereas many other counties kind of kept pushing, kept moving forward.
San Diego was one of those counties. Public health officials allowed restaurants to reopen at limited capacity in late May, then salons and barber shops a week later, then gyms, hotels, and bars 2 weeks after that. Supervisor Nathan Fletcher unsuccessfully advocated for a more restrained approach.
The minute we can possibly open things, we open things. They chose to be more cautious. And by doing that, they have not lived on the precipice of open close.
Alday says the San Francisco region has another asset, its history with public health. The city was the epicenter of the AIDS epidemic in the United States in the 1980s, which established a robust public health response. She says it also established a trust between the community and public health officials.
You just don't get any of that kind of I don't know, is this real? Do I trust what my leaders are saying?
Another possible reason San Francisco and Alameda counties have lower case counts is that inequality is more pronounced there than in San Diego County, says Rebecca Fielding Miller, an epidemiologist at UC San Diego.
So in some ways it comes back to housing prices, like most things do in San Diego. Like people who are residents in those large counties are people who can afford to live in those large counties, whereas their essential workforce is pushed off into other counties and has to commute in. At least across the county of San Diego, housing prices are diverse-ish enough that the frontline workers, the people who are really at the highest risk, also live in the same county.
Despite its demographics, there is plenty San Diego County can control, she says. The county could adopt a more gradual strategy of reopening and further boost its outreach efforts in the South Bay and other parts of the county that are being hit hardest by COVID-19. Claire Tregesser, KPBS News.